Atrial fibrillation, also known as AF or AFib, is a type of irregular heart rhythm that affects more than 30 million people worldwide. People with atrial fibrillation are more likely to have a stroke. This is because blood within the heart may not be able to circulate normally. When this happens, blood can get stuck in a small pouch that sits off the left side of the heart, known as the left atrial appendage or LAA, and a clot can form. If left untreated, the clot can enter the bloodstream and travel to many parts of the body. If it travels to the brain, it will cause a stroke. To reduce the risk of stroke, doctors often prescribe a blood-thinning medication or anticoagulant. These medications prevent blood clots from forming, but they may not be appropriate for everyone. A procedure called the left atrial appendage closure is an alternative to blood thinners. It involves implanting a small umbrella-shaped device that will permanently seal off the appendage in the heart where the clots can form. To make sure the procedure is as safe and as effective for you as possible, you will undergo tests like a CT scan or a specialized echocardiogram. These tests will help your doctor determine the size of the device needed and plan for your procedure appropriately. The procedure does not require open heart surgery. It is done in what we call a catheterization lab or cath lab. On the day of your procedure, you will be prepped and given anesthesia to put you to sleep. The specialized device will be guided by a catheter through a vein in the upper leg and into the left side of your heart. Once in position, the implant is released and seals off the left atrial appendage. Over time, heart tissue grows over the device to create a permanent barrier. The procedure typically takes 1 to 2 hours, and most patients go home the same day. You will be prescribed blood thinners for the first 3 to 4 months to help prevent blood clots until the heart tissue grows over the device. Complications are rare. If you notice bleeding at the site of your incision, lie flat and put pressure on the wound for 10 minutes. If the bleeding continues, call an ambulance and go to your nearest emergency department. Other rare but important symptoms to watch out for in the first few weeks are stroke, fainting, or breathing problems. If you experience any of these symptoms, speak with your doctor.